In the last 10 years, musculoskeletal physiotherapy has changed quite dramatically with the introduction of extended scope practitioners, injection therapy, ultrasound scanning, as well as other things. With this in mind, what do you think physio will be like in 10 to 15 years in the future?
I think that probably where we're going to be at is that it will be that physiotherapists are leading all musculoskeletal services across the country. I think that what you see here at Medway is definitely leading edge, but I would say even what's here is not universal across the country by any means. So even though there's quite a lot of change from 10 to 15 years ago here, we need that scaled up across England, across the UK. And then I think the next step is to scale up so that it is automatic that MSK services are led by physiotherapists. And also, I think probably more key is that it's totally accepted by the public that if they have a musculoskeletal problem, the first thing they think of is going to see a physiotherapist.
How does the CSP plan to move that forward, to promote us better?
Well, I think the trouble is when people make comments like, what is the CSP going to do? Of course you are the CSP. The CSP is 53,000 members, so you probably mean what are the staff of the CSP going to do? And I think it's actually quite limited what we can do. So we can promote best practice, we can help share the practice, so from here and try and spread it around. But actually it's for local physiotherapists to inform commissioners about the potential. And it was interesting listening and talking to physios here today that really haven't done very much about promoting and selling the offer of physiotherapy, particularly around MSK. And yet it is so fantastic a service here. So what I want to see the CSP staff do is encourage, enable, give you the tools to be able to do the local influencing, because that is not something that 150 staff at the CSP offices can do. That's something that each and every physiotherapy member is going to have to do. And I think our job is to tool you up to be able to do the influencing, to have the right conversations, to have the data, to be able to sell the offer.
At kind of grassroots, almost whilst at university, that needs to be put in by the universities a little bit more, so that physios feel more equipped or have that bit more knowledge of what's going on as to when they do become band 5s to progress on. Do you think they need to start a bit earlier?
Well, I think there's lots of things that people will say needs to be in the pre-graduate, the pre-registration training, but nobody ever tells you what should be dropped. And let's be honest, when you're first training as a physio, you just want to develop your clinical skills. What I have seen with the training programs is that a lot of these other skills, marketing or business skills, understanding the NHS, is an inherent part of the way they're being trained. So even going on different sorts of placements into different areas, having to produce data to inform their dissertations or some essays or whatever work they're doing, being able to stand up and present. There's something about developing your skills in being able to influence. So I think that the training is changing, but what I do think we need to do as part of the training is ensure that we maximise the skills and expertise that's there. So for example, compared to when I trained, which is obviously hundreds of years ago, there are far more mature students who have come from banking and business, and it seems to me that we don't use the skills that they've got to disseminate them amongst the physio student cohort. The other thing that does concern me is often students come out with quite a lot of entrepreneurial skills and approaches and attitudes to doing different things and are quite motivated. What concerns me is what happens in those first 2 years, and I think there's something about mentoring and coaching at that level to make sure we don't lose that spirit that people come out with.
Yeah, definitely. AQP has meant a huge change for the team here at Medway Community Healthcare. What do you think the main advantages are for us staff and for patients, and any potential drawbacks of this?
I think whether it's through AQP or any other contracting process, I think shifting from a model of service delivery that's where the staff are employed, contracted to the NHS, into something else is scary for people who work in the NHS, because it's fear of the unknown. And I think in the past, and probably when this organisation moved into becoming a social enterprise, there was a real feeling that the NHS was solid, secure, going to be there forever. And so a leap into something new was like a leap of faith, and into something that was more insecure, who knew where it was going to go and end up. And actually I think nowadays things are really different, and the NHS is going through a big shake-up and a big wake-up call anyway. So I think the shift from working in the NHS through a different contract, whether it's through AQP or what, into social enterprise, for example, is not such a big leap as it was. But I still think it's scary, because we don't traditionally like change. I think the big issue is often terms and conditions. But I have been to independent sector organisations, physiotherapy businesses, where NHS staff have moved from the NHS terms and conditions into organisations where they have lower terms and conditions. They have chosen to do that. It hasn't been a contractual thing. And actually, because of the other benefits of flexible working, of being able to spend more time with patients, having more clinical autonomy, they have really enjoyed it. So I think terms and conditions are one element, but I think there's a whole range of reasons that people go to work. I think the positive attributes really of going into social enterprise has to be that you have more self-determination, more control. There's probably less bureaucracy. I mean, in any organisation there will be rules and processes that you have to go through, but I suspect they're less onerous than if you were in the NHS. I think there's probably the ability to innovate much quicker, to have an idea, take it somewhere, to try it out and continue with it or not. So I really wish that lots more people, when the opening came around social enterprise, had taken that up. And I think those organisations that did, and those individuals who did go through that leap of faith, it was tremendous, and I hope that they're feeling it was worth it. But I think it's more the ability that it has for you to control more yourself.
I think that's something we found, that as a social enterprise we now offer services to our patients outside of our traditional NHS provision. So we sell equipment, we sell Pilates classes. How do you think that physiotherapists can advertise our unique selling point a bit more to the local area, to the wider populations? What is it that being a physiotherapist has more so than other?
Well, I'd love to turn that round back on you, but I probably won't. I think the unique selling point for a physiotherapist is that there's several. We make complexity easy. So explaining difficult concepts, explaining diagnoses, treatments, whatever, we can do that in a really easy way for patients. So I think we're really good communicators. I think because we operate in the biopsychosocial model, not just the medical model, we are much more rounded in our offer. So yes, we're able to offer the medical end of healthcare around drugs, injections, prescribing, treatments, etc. But we also offer a psychological approach through CBT, for example, and working in the community. And I heard this morning from the paediatric physios an awful lot of what they're doing is actually liaising between education, social care and the health service. So in a physio, Lord Aradazi once described us as the glue in the healthcare system, and I think that we really are, because of the biopsychosocial model, because we're really great communicators, and I think we also have an ethos in our training that often we don't realise but others spot, which is about enabling and empowering. We do not create dependency on us. Our very ethos is about enabling people to be independent. That is very different from doctors and nurses. And I think that in an age where the demographic is that people are living longer, what we've got to focus on, and our, if you like, really unique selling point, is the focus we have on the quality of life people lead. So it's not just about adding years to life, it's about adding life to years, and that's what physiotherapy does. And I think over and above all I've said, that's probably the unique selling point that we've got.
What are your 3 top pieces of advice for anyone aged 16 to 18 considering a career in physiotherapy?
Go and spend some time with a physiotherapist, and probably don't just go and work or observe an MSK clinic, because I certainly only went into physio because I wanted to be a football physio. I didn't have a clue that we did anything else. And I think that that's quite dangerous if you end up in physio, training as a physio, and you think it's just MSK. So I would certainly go and get some experience watching and seeing and learning about physiotherapy. I think if you're thinking about work experience and something a bit more concrete, something where you're dealing with and working with people is really important, because those skills really are required. I remember talking to some student physios a couple of months ago, and they'd just come back from their first placement, and they said the scariest thing of everything was when those curtains were pulled round you and you were sat there on your own with a patient trying to think of something to say. And I remember that, even me, who has quite a lot to say about most things. So I actually think doing some sort of work where you're working with other people is really important. And then, you know, 16 to 18, you've got to focus on your sciences in terms of your studies.
And what about newly qualified physios? How does the CSP as an organisation help to support new grads?
Yeah, I think this is where I would like us to be doing more. We do a lot with students, and I think there's a gap between that sort of newly qualified and then maybe a couple of years, 18 months, a couple of years in, when you find your way round the CSP a bit more. So I think there's something that we need to possibly fill during that time. And you know, when I qualified, you know, again, this was a long time ago, but I think there was probably more hand-holding than there is now. Now, I don't want to go back to sort of hand-holding junior physios or anything like that, but there is something I think the CSP needs to do by way of transition from student into that position where, you know, you found your way, you know what you're doing. And I think what's really important is that we don't allow the sort of excitement and passion and motivation that you qualify with being knocked out of you, really.
Our monthly CSP fees are around £27. What do you feel that we can gain most out of this membership, and do the CSP consider money saving costs for us as physiotherapists?
Yeah, since I've been Chief Executive, we've not put the fee up by more than 1%, which has been tough in terms of managing the CSP finances. We're a business like any other business, so we have demands, I've got salaries to pay, etc, etc. So actually keeping it to 1% has been quite difficult, but I've been quite clear, particularly as most of our members are in the NHS and the salary rises have been minimal, if anything, that we keep our fees as low as possible. I think it is a lot of money for a lot of people, and so what's important is that we are able to show our value. The trouble is with the CSP offer at the moment, I think, is that when you need it, it's fantastic. So if you need the trade union support, if you need legal support, if you need public liability insurance, if you need professional advice, I've heard loads of examples today of people using all of those services and have nothing but, you know, praise, and said that their fee has been totally worth it. If you've not used or need any of those things, you might be thinking, well, what's the point?
Where does my money go?
Exactly, what does it go on? And I think that that's why I'm really keen to come out on visits to hear what more people want. What I'm quite keen on is that we as an organisation become more visible locally. Now, with 150 staff, the whole of the UK, there is no way you're going to have a member of staff per area or anything like that. But there is something about how we conduct our business to feel, so that you feel like it's more relevant. And also I want to try and break down a bit of this, the CSP staff and the CSP members, and try and get a bit of flow. I would love to see secondments coming in and work, because to work at the CSP you get all sorts of opportunities nationally, internationally, and it would just be great to sort of get some turnover between the members and the society. So I think what we have to do is be much clearer about our offer, all of those things that I've described, be more visible, and just be really effective and efficient in the way we do business. Part of what I'm leading at the moment is called a change program called Good to Great, which is about how we run and how we do things in the CSP. And I'm very clear that there would be far more effective and efficient ways of doing things, which would mean that we could keep any rise in fees to a minimum. But all the time, equally, we're looking at opportunities to give members. So, for example, a big program around leadership or mentorship or coaching, which was what some people were asking for this morning, it costs money. And as a membership organisation, you know, our business model is that most, up in the 90% of our money comes from the member. We don't have, you know, very much income through any other route.
Okay. Last year, one of our physiotherapists won a patient-nominated award for his use of technology. He filmed someone doing their exercises during a session on their phone. They took this home to use to help them through their home exercise programme. What do you feel that the CSP feel about using technology, and is there more that we can do as a profession to involve this?
Yeah, I think you know, it's one of those questions, isn't it? What can the CSP do? Meaning us at 14 Bedford Row. Actually, you're doing it, and you know, I've heard and seen of lots of physios using all sorts of technology, and you know, it's about telling everybody about it. It's about telling us about it. We can only promote it if we know about it. We have a real problem when, for example, the government ask for examples. I was in a meeting last week with NHS England. They wanted examples of physios using technology. You know, it is really difficult for us to get physios, members, us, the CSP, to tell us. And without that information, you know, we can't promote. So there's a sort of there's a deal here that I need members to tell us what they're doing, particularly when it's leading edge, so that we can capture it and use it to promote the profession when we can. I think particularly when you think about the older population, the need to keep people out of hospital, at home, the use of remote technology, wearable technology. I think Frontline a few months ago did a whole thing on all the technology that's going on and being used. We are trying to promote it as much as possible. The other side to technology that gets talked about less, and going back to your first question about MSK, this might be something in the next 10 years, maybe even sooner, that needs to be borne in mind with MSK, is genomics, and the fact that we will be able to recognise before birth who's going to have what disease. That's going to change hugely physiotherapy, and potentially MSK physiotherapy in particular. So I think when we think about technology, mobile phones is not new and innovative. That's done really. It's robotics, it's genomics, it's all these other technologies that are out there. And for example, the expo, the Innovation Expo in September, is anybody from here going? That's where you pick up some really amazing stuff, and also go and tell others about the amazing stuff you're doing.
On a similar note, social media has increased considerably in the past few years. Use of Twitter, Facebook, LinkedIn, which Medway Community Healthcare have and use. How do you think that physiotherapists individually, as well as organisations such as our own, can promote our services through using this? And what about unsanctioned use and guidelines around using it?
So the CSP produced earlier this year guidance for members' use of social media. And it's really great advice. The HCPC has produced guidance on registrants' use of social media, and I would point any clinician to that guidance. Really, really important. It's very clear to me that a lot of people use social media inappropriately, and it needs to be used with care. I personally only use Twitter simply because there's just not enough hours in the day for me to use anything else, and I've only just got to grips with that. But I have found it fantastic at keeping in touch with and raising visibility of what we're doing at the CSP. I found it particularly invaluable with the students who know no other way of communicating. And I think the CSP, we need to recognise that the days of meeting in a room to discuss issues are way gone. On the other hand, what we have to bear in mind at the CSP, as in the organisation I manage, is that only 10% of the 53,000 members use any form of Twitter. So it's a bit like any time we think about making Frontline just an online magazine. Actually, we've got whole loads of members who don't use digital technology at all, and really do prefer to have the paper document. So at the CSP we have to sort of use a multimedia approach to all our communication. But I think there's no doubt that we won't be going backwards from now, and I think I encourage individual members to get on Twitter or Facebook as much as they can. And at Physio UK last year we ran surgeries on teaching people like me how to do it, and we've got a big session on social media at Physio UK this year. So I think it's great for individuals, and it's great for organisations to be able to promote what they do. I think some of the areas where we have to be careful or think is, there are times when it isn't what people say, it's how they say it that is inappropriate in my opinion, and you lose the message through the way it's been communicated, particularly not showing any respect. I think the other grey area, which is quite difficult, is I love to see the clinical conversations that go on. Obviously this is not involving patients or revealing any names or anything like that, and the challenge about evidence, which is great on the one hand. On the other hand, we have to recognise that not just physios are looking at this stuff. And I don't know about you, but if I saw my dentist on there asking about, is this a good treatment, or is there any evidence for this or whatever. I wouldn't be too impressed, because I like to think my dentist knows everything about dentistry. So there is something about how the profession is perceived. Is it perceived as one that is constantly challenging and able to challenge what is evidence and its practice, or is it being perceived as a profession who hasn't got a clue? So it's a real fine balance with the use of social media, but I think it's, I just think it's entirely positive, and I just think the guidance is worth reading and understanding, and that you're a professional 24/7. I think lots of clinicians I've met think because they put my own views, or it's not an organisation's Twitter handle, that somehow that excuses them from having, from how they behave on social media, and it doesn't. Yeah.
I think that's a big thing as well, from using it myself firsthand. The CPD that I've been able to do from that is fantastic, and the discussions that you have, you can be talking with ESPs from anywhere else in the world, or orthopaedic surgeons or whatever, so it's absolutely fantastic, but there is a massive fine line on how you are perceived, and there's been a bit of trouble with some physios on there using things inappropriately, etc. I think as well with evidence, a lot of other people that I may speak to will read something on Twitter and say, oh yeah, I've read some evidence on the latest treatment for a shoulder thing, and they've just read a tweet about it. So I think it's a lot about using it as a platform and then doing your own development from there.
I think there's a real there's a perception issue with it. Taking it completely outside of the physio world, because Norman Lamb was a minister at the Department of Health, I was following him. Then after the general election, he lost his seat, lost his ministerial position, but I still happened to be following him. So when it came to the Liberal Party's leadership campaign, I was still seeing all the tweets that he was making and anything that referred to him. So we were talking at work about the leadership campaign for the Liberal Democrats, and I said, well, it's bound to be Norman Lamb that's going to win, because I'd seen all this stuff. What I hadn't seen was the other candidates' Twitter sort of coverage, and of course he lost. But it just illustrated to me how my perception of the world had been completely dictated to by who I happened to follow.
Yeah.
And so I think it's a real lesson. Yeah.
During your day here at MCH House with the Musculoskeletal Physiotherapy Department and the Clinical Assessment Service, how would you describe your day here?
I think it's multi-layered, so I just love being with patients again. I mean, only 3, but it sort of gets me back to remembering why I became a physio. It also illustrates to me that if I ever considered going to practice clinically again, I probably need to do some major retraining. So from that point of view, it just reminds me, the enormous difference that a physiotherapist can make. And I think sometimes you have to step out of the profession and look in to really realise, the privilege of a person walking in pain and walking out in no pain as a result of something that Suresh has done or anyone's done is such a massive privilege, that I don't know that when you're in it and doing it you quite appreciate it. And so for me this morning was very much a reminder of why I became a physiotherapist, because of the difference I could make, and B, what a fantastic profession it is, and what an offer we have, and why it's so important that I in my job, you in your job, whoever is involved in physiotherapy sort of gets that message and that unique selling point out, because actually what's so important, that it isn't just available to the people in Medway or the lucky people who can pay for it, but to everyone. I think I've really picked up on the social enterprise vibe. I go to a lot of physio departments, and you can almost detect and feel the culture. I always describe it about a lady once talked about going on a ward, and she said that within 5 steps you could tell what the culture of the ward was, and you can tell as soon as you walk in here, it's not just the nice environment, but there's a feel, and I think that sort of social enterprise feel comes through. People seem really, really happy at work. We all get days where you'd rather not be at work, but it feels like everybody's really pleased to be at work. And over lunch, just listening to the different things that people had got involved in, it sounded very innovative. It sounded like if you had an idea, the organisation would allow you to run with it a bit. So I think that sounds fabulous. So it does just sound a brilliant, brilliant organisation to be part of.
Thank you very much.
You're welcome.